Welcome to our channel and subscribe us. Today we will see the anemia. This is the normal blood cells in anemia. This is the anemia condition of the RBC blood, right? Then we will see the definition of the anemia. The anemia is the blood disorder characterized by the reduction in red blood cell count, hemoglobin count, then packed cell volume, right? This reduction produce the anemia. Then classification of the anemia. Anemia is classified by two methods. First one is the morphological classification. Second one is the etiological classification. Then the morphological classification, there is the four types of anemia: normocytic and the normochromic. Mean the size of the RBC and color of the RBC both are normal. Then the normocytic and hypochromic, the size of the RBC normal, the color of the RBC less. Then microcytic hypochromic, macro means size of the RBC large, then color of the RBC less. Then microcytic hypochromic microcytic means small, hypochromic means less. The example for the microcytic hypochromic anemia is the megaloblastic anemia. The microcytic and the hypochromic anemia is the iron deficiency anemia, right? Then we will see the etiological classification. On the basis of the etiology, anemia is divided into 5 types. First one, hemorrhagic anemia, hemolytic anemia, nutrition deficiency anemia, ablastic anemia, then anemia of the chronic disease. Then first we will see the hemorrhagic anemia. The causes of the hemorrhagic anemia is acute loss of the blood, right? This anemia types is the normocytic, normochromic. Then is the chronic, another cause is the chronic loss of the blood. That is the macrocytic and hypochromic. Chronic loss of the blood leads to the loss of the iron. So iron is the used to produce the hemoglobin in the RBC. So there is the no RBC. There is the no hemoglobin in the RBC. The RBC become a small, right? Then we will see the hemolytic anemia. Hemolysis means destruction of the RBC. The anemia due to excessive hemolysis, which is not compensated by the increased RBC production, is called as a hemolytic anemia, right? It is also classified into two types: extrinsic anemia, intrinsic anemia, right? Then we will see the common causes of external or extrinsic hemolytic anemia. First one is the liver failure, then renal disorder, hypersplenism, burns, infection like hepatitis and malaria and septicemia. Then the drugs such as the penicillin, antimalarial drug, and sulfa drugs means sulfonamide drugs. Then the poisoning by the chemical substance like lead, coal, and tar. Then the presence of the isoagglutinin like a anti-RH, right? Then the autoimmune disease such as rheumatoid arthritis, ulcerative colitis. These are the causes of the external hemolytic anemia. Then we will see the intrinsic hemolytic anemia. It is the type of anemia caused by the destruction of the RBC because of the defective RBC, right? Defective means abnormal shape of the RBC. Intrinsic hemolytic anemia is often inherited and it is include the sickle cell and the thalassemia, right? The example for this anemia, sickle cell anemia and the thalassemia. These are the hemolytic anemia. Then we will see the third one is the nutrition deficiency anemia. Anemia that occur due to deficiency of nutritive substance necessary for the erythropoiesis. It is called as a nutrition deficiency anemia. There are three types of anemia: iron deficiency anemia, in the megaloblastic anemia, and pernicious anemia. These are the nutrition deficiency anemia. First, we will see the iron deficiency anemia. The iron deficiency anemia is the most common type of anemia. It develops due to the inadequate availability of the iron for the hemoglobin synthesis. So RBC are the macrocytic and hypochromic. There is a no hemoglobin, RBC become a small. Then causes for the iron deficiency anemia. First one is a loss of blood. Second one is the decreased intake of iron. Then the poor absorption of the iron from the intestine. Then the increase the demand for the iron in the condition like a growth and pregnancy. These are the causes of the iron deficiency anemia. Then we will see the some features of the iron deficiency anemia. Then brittles in the nail. Then spoon-shaped nail, right? That then is the brittle hair, right? Then the atrophy of the papilla in the tongue. Then the dysphasia, right? These are the some features of the iron deficiency anemia. Then we will see the other nutrition deficiency anemia is the megaloblastic anemia. The megaloblastic anemia is due to deficiency of the another maturation factor called as a folic acid. Here RBC not matured. The DNA synthesis is also defective. So the nucleus remaining immature. The RBC are the megaloblastic and hypochromic. What will happen in the megaloblastic anemia? The folic acid synthesis not occur. DNA synthesis depend on the folic acid, right? The folic acid deficiency causes this megaloblastic anemia, right? Then we will see the pernicious anemia. The pernicious anemia is the anemia due to deficiency of vitamin B12, right? It is also called as addition anemia. It is due to the atrophy of gastric mucosa of autoimmune destruction of the parietal cells, right? Right? This is the pernicious anemia. Then we will see the ablastic anemia. The ablastic anemia due to disorder of the red bone marrow. The red bone marrow is reduced and replaced by the fatty tissue. So RBC is produced in the red bone marrow, no? So it is the reduced and the replaced by the fatty tissue due to the ablastic anemia occur. Then we will see the anemia of chronic disease. The anemia of chronic disease is the second common type of anemia next to the iron deficiency anemia. The iron deficiency anemia is the most anemia. The second is the anemia of the chronic disease, right? The RBC are the normocytic and normochromic. Then we will see the common causes of the anemia of chronic disease, right? Non-infective inflammatory disease such as the rheumatoid arthritis. Then the chronic infection like tuberculosis. Then chronic renal failure. Then the neoplastic disorder. These diseases causes this anemia. That anemia causes anemia of the chronic disease, right? What are disease? rheumatoid arthritis, tuberculosis, renal failure, and neoplastic disorder. That means tumors. Then we will see the common sign and symptoms of the anemia. First one is the color of the skin and the mucosa membrane become pale, right? Paleness. Then the increase the heart rate, also palpitation, right? Then the anorexia, right? Then nausea, vomiting, abdominal discomfort. These are in the gastrointestinal tract. Then the albinuria is a common in the uh, renal system. There are maybe menorrhagia, oligomenorrhagia, right? Then amenorrhea in the female, right? Then sensitive to cold, headache, lack of concentration, restlessness, irritability, then drowsiness, dizziness or vertigo, uh, dizziness occur especially while the standing, right? And painting. Painting means sudden loss of the blood supply in the brain. This is the called as a painting. These are the common sign and symptoms of the anemia, right? And thanks for watching our channel and subscribe us.